Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Dr. Elizabeth Stewart and Dr. Carrie Althoff, two faculty members at the Johns Hopkins Bloomberg School of Public Health, about what decisions need to be made before traveling for the holidays during the latest surge in COVID-19. Let's listen.
Carrie Althoff and Liz Stewart, thanks so much for joining me.
Thanks for having us.
Great to be here.
It's great to have you guys back. So I watched coverage of people packing into airports over Thanksgiving, and it raised my blood pressure because all I saw was super spreading events. Carrie, what's the first thing we really need to think about with another holiday season absolutely upon us already?
I think we just have to be aware that this risk-benefit calculation of gathering is constantly changing. And right now what we're seeing is that the risk is going up and up and up with more cases and lots of community transmission going on right now. So, we really have to survey our families and our friends and say, okay, is there somebody who really absolutely needs some face-to-face contact because we're worried about their emotional or mental health? Is there somebody that we need to pull into our household? And maybe it's just one other household that we pull in order to have that connection, and really think about that cost benefit, because it is very risky right now. So the benefit of that engagement needs to also be really high. But if you find yourself saying, you know what, we can meet on Zoom or whatever webcam that is your preference, then the most simple thing to do right now is to stay home and celebrate within your household. And we say that realizing that that is a sacrifice, and that is a sacrifice that's being asked.
Mm-hmm. So my gut reaction, of course, is, okay, everybody, just stay home. But Liz, it's not that easy, is it?
No, it's not. I mean, it might be for some of us. And I think those of us who can stay home without a lot of sacrifice, as Carrie was just noting, maybe if you're fine with Zoom, I will say we had a really lovely extended family Zoom over Thanksgiving with breakout rooms and a scavenger hunt. And, it wasn't the same as being all together in person, but at the same time, it really helped us connect. And so if you are sort of in a situation where you can find these other ways to connect, and that is meaningful for the people involved, I would really just encourage that. I think it is the thing where, as Carrie was saying, think about the situations where there's someone maybe particularly isolated, someone for whom that Zoom interaction or sending a special care package just isn't going to be sufficient for them during this time. That's when you might want to consider the logistics and the challenges and sort of how to make it work to actually see them in person.
So if someone is going to go travel for the holidays, we got to start thinking about this like yesterday, right?
Absolutely. I mean, in the best case scenario, you're planning things 3 weeks in advance, right? So let's say you have identified a family member who is pretty isolated and you would like to see them face to face for the holiday. That family member is high risk. There is no better way to lower risk than to be quarantined for 14 days prior to seeing that individual. And remembering that high-risk individuals are people who are older, people who are obese, individuals who are at greater risk for very severe COVID disease or death. And so you really want to protect them. You want to start that quarantine, but you should start all of that with a conversation that says, hey, 3 weeks before the event, we need to talk about what we're going to do to kind of hamper down and hunker down and release ourselves from all these different exposures by being at home, being in a quarantine, so that we can successfully see each other face to face without anybody getting sick, without any transmission.
Mm-hmm. We had talked, Carrie, about how, let's say you were planning a New Year's party. Can you walk us through sort of a scenario that you'd need to think about?
Sure. So, let's call it a gathering because I think the party is probably just out
Right.
of
Yes. We don't want to have no parties. Thank you. No parties.
Let's say you have someone that you would like to bring into your home for New Year's Eve, just for a gathering. You're concerned about them and their well being. So you bring them into your home. So essentially, how this starts is if that individual is high risk, you want to be sure to have a conversation by December 10th and set the goals and the ground rules around what that gathering is. You really have to make sure both of you are on the same page about how you're going to reduce your exposure prior to that gathering. By December 17th, which is 2 weeks from December 31st, you will need to have traveled and started your quarantine if traveling is required and if that individual is high risk for severe COVID disease. By December 24th, if the individual is not high risk for severe COVID disease, December 24th is 1 week before New Year's Eve. And that would probably be the day you want to start at least a 1 week quarantine and maybe try and get tested in there. So maybe testing around, let's say, December 28th or so. Hopefully you can get the results back in time, although I think we have to be very aware that testing demands continue to fluctuate. And so the time to get a test and the time to get the results is also very variable across our country. So it really is a process, right? It's like a 3-week process to bring someone into your home for a gathering on December 31st or whatever day you pick. And then there's also a 2-week vigilant period following that gathering, right? So monitoring symptoms, really possible quarantine, isolation. If you traveled, consider getting tested, 5 to 7 days after your travel, just to make sure that you are healthy and that you're not inadvertently transmitting to others.
Mm-hmm. Liz, my stepson went to get a COVID test in Columbia, Maryland, the week of Thanksgiving, and he waited in line for over 8 hours. Are we going to see things like that? And is that going to really hamper this whole idea of getting tested before seeing people?
That sounds like a pretty extreme situation. I hope that will not be common, but at the same time, I think we can't rule it out as cases continue to rise. And so people have symptoms and want to get tested because of symptoms. And also as more and more people are thinking about potentially traveling with all the caveats that Carrie was mentioning, a lot of people around the country are going to be wanting to travel and thus get tested right around the same few days. And so I think we have to be realistic about the testing limitations and the testing availability and really be prepared that it might not work out exactly as smoothly and precisely as you might be hoping. And that should very much be a part of the planning. And sort of to that point, in some of our previous conversations, Carrie and I have talked about making a plan B and even a plan C. And I think that continues to be very important, that sort of we have to really go into all of this planning as much as we can, but then also realizing that those plans might fall apart and we might need to adapt on the fly.
Mm-hmm. So I want to talk, Carrie, about the word quarantine. So I have a relative who has a new grandbaby, and in the days before she was planning to drive to see the new grandbaby, I said, "Oh, have you been quarantining?" And the first thing she said was yes. And then I said, "Well, have you been going to work?" And she said, "Yes." So I'm wondering if we could sort of talk about what we mean when we talk about quarantining.
Right. So quarantining, I think people are using the term in a lot of different ways to suggest that there's some reduction in your exposure, right? But quarantining is actually when there is almost no or incredibly minimal exposure. So it isn't going to work. It isn't going to a grocery store. It's having groceries delivered by the store or somebody that you know. It's having prescriptions delivered by the pharmacy or by someone you know. It really means staying home and not having contact with other people, not having contact within 6 feet, definitely wearing your mask if you're even outside of your house. But it means to stay close to home in your house.
I think the thing I would add too is that earlier we talked about potentially traveling, say for a New Year's Day party. It doesn't really work if you quarantine at home and then fly there on December 30th. That defeats the whole purpose of the quarantine because you've now just re-exposed yourself through the travel. So the quarantine ideally really happens in the same location approximately as the in-person gathering. So travel and then quarantine for 2 weeks is really the ideal.
Mm-hmm. My holiday is not Christmas, so it's easy for me to say this, but my holiday is Thanksgiving, and I always go visit my parents for Thanksgiving, and I didn't this year. 2020 is hard, and I didn't want to expose myself or my parents to any danger. Why can't we, Carrie, just say, 2020, Christmas, New Year's, it's just not happening this year?
These holidays mean different things to different folks, and it has been a hard year. And I don't think anybody can deny that. And so we have to recognize that the sacrifice of staying home for these holidays means different things to different people. If you can take that sacrifice and say, you know what, that is something that I can do for myself, my family, my community, do it. Don't think twice. Just do it. If it's something that is a sacrifice that seems more overwhelming to you, or perhaps you don't think it is appropriate given the fact that you have a family member you're very concerned about, perhaps that family member has even lost someone this year and it would be their first holiday very, very alone. Okay, so the sacrifice there is then it's not a big holiday celebration, but rather it's a reach out to that one person or that one household to bring them in. But it's also the sacrifice that goes on beforehand with true quarantining and making sure that you're doing everything you can to reduce your risk before you have that interaction. So there is sacrifice no matter how you cut it. There will be sacrifice this year, but it is also important to recognize that science is moving forward at a breakneck pace, and science will be the light out of this tunnel. And so this is not forever. This is not going to be year after year after year. So think about what you would love to do for the winter holidays and start planning a summer or fall or next winter event with all those people that you choose to gather with, and think about that to kind of get you through these next few weeks.
And Liz, this is going to take a mental toll on people, no matter what, isn't it?
It will. And myself and others at the school and around the country are studying this and trying to figure out ways that we can make sure that the people who are really struggling with mental health challenges right now are getting the supports that they need, and that we can help prevent initial and sort of the current mental distress from turning into larger problems. And so it's something we do really need to keep into account and sort of make sure that we are developing strategies to help those people that are struggling. But I love Carrie's kind of looking forward optimism. And I think that's exactly right, that it might feel right now like this is forever, but there are some really exciting developments. And I think that we're all hopeful that this will hopefully be the last holiday season, at least in the immediate future, where we'll have to worry about this.
Well, then I'm going to leave it on that very upbeat note. Liz Stewart and Carrie Althoff, thank you so much for joining me.
Thank you.
Happy holidays.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.